Hello, ladies and gentlemen. Welcome to this highly anticipated live interview on regenerative medicine. Today, we have the pleasure of being joined by the esteemed Dr. Daniela Farkas, a leading expert in the field. Dr. Farkas, thank you for joining us today.
Thank you so much for having me.
Let's dive right out our discussion on regenerative medicine. Our viewers are eager to learn more about this fascinating field. So, what exactly is regenerative medicine and how does it differ from traditional medicine approaches?
Regenerative medicine is like rebooting of the computer. What it is, it goes back to the time when a tissue was new, like brand new. Like, for example, if we regenerate the knee from an arthritic knee of like 60 or 80-year-old, we go back to where it was like 40 years ago. So we regenerate or we reboot the computer or we regenerate the yes, that's the idea. We regenerate or make new again.
Wow, so interesting. Stem cell therapy has garnered significant attention in regenerative medicine. Could you explain how stem cells are being used to treat joint problems like knee and ankle injuries?
Yes, in my practice we are using stem cell for the last 8 years. um, what we do, we take the stem cells that are manufactured here in Miami, and they are manufactured in a facility, in um, a pharmaceutical facility that gets the raw material, which is umbilical cord of C-section babies. The reason they use C-section babies is because if a baby is born vaginally, the umbilical cord and the placenta will be contaminated with the vaginal flora. Therefore, you have to have a C-section baby in order for the uh, cord to be usable and to not be contaminated. Also, from 100 C-section donated uh, uh, umbilical cord with placenta, about two will be selected only to go further and to be used as stem cell therapy for other people, because for the first 2 years, the placentas are subjected to very rigorous testing to test for a lot of sicknesses like HIV, syphilis, cancer, whatever it could be that could potentially interfere with the receiver. So it should not create an issue down the line. So from 100 placenta, about two would be selected only to go forward. So regenerative stem cell would be used to get cells that are pluripotent, meaning that they have the ability to regenerate any tissue in the body, and the time is time zero or time of birth.
Wow. um, Next question about this topic. Many viewers may be curious about the safety of stem cell injections. What are the potential risks and complications associated with this treatment?
A fascinating question. It is the question that a lot of people are asking because you do not want to share any potential complications from a receiver. Um, Once the stem cell are approved for the public use, the potential of sharing any viruses or any potential bacteria are pretty much zero. Uh, it is the stem cells that are selected are absolutely immunoprivileged, means it has absolutely no capacity of of transmitting any diseases. or be a carrier or a facilitator for any types of viruses or bacteria. None whatsoever. Actually, this was the reason that FDA got involved, um, because the manufacturer had to prove that this is absolutely, absolutely safe. Uh, to my knowledge, from this particular factory where I buy the stem cell, had over 100,000, I mean, a million um, donors as of now, and they had absolutely no contraindication, zero, up to date.
Oh, that's great. Are there any age or health restrictions for individuals seeking stem cell therapy for knee or ankle problems?
Up to about 3 years ago, we had a restriction because that if somebody has cancer in the knee or bone cancer, we should not give stem cell because it was the risk of making the stem cell flourish. Now we know that stem cell actually could be used as treatments for cancer. So it's not an indication anymore, but a potential treatment. Uh, this is still in the research phase. They did get the preliminary, they are testing it. Uh, on the animal model, it seems to work unbelievable great as a treatment, not as a counterindication. Other than this, there is no counterindication. We do have stem cell in our body. So the stem cells that we have in our body help regenerate any tissue that is damaged. For example, if you have any type of surgery, if you have any type of trauma, the body needs to repair that trauma. And the way it repairs, it does use some stem cell also.
Great. Um, how do stem cell injections compare to traditional treatments such as surgery or medication in terms of effectiveness?
Yes. Um, for example, I broke my knee skiing in 1996. I broke the tibial plateau, my own. I broke one of the cruciate ligament and I broke the meniscus in three parts. At that time, I was already a doctor. I was working in the hospital, and everybody that I knew on the field told me that there is absolutely no cure except surgery. I opted not to go that path because I don't want the pain associated with the surgery and the recuperation. So I injected my knee with stem cell. Um, at this point, I could honestly say that the stem cells are not, they did not reverse my problem 100%. Uh, but on day to day, this is 25 years later, I have no problem whatsoever. Sometimes I do go hiking or I go skiing, and when I do that in the evening, I do have pain in the knee. But on a day to day basis, there is zero restrictions, like no pain whatsoever. Um, After I had the injection, the downtime was about an hour. So for 1 hour, I had to stay still and not to walk a lot. But after that, there was absolutely no physical therapy, no money involved after that, no downtime, none. So yeah, compared to surgery, if I would had done arthroscopic surgery, I would have scar tissue in the knee. I would have had possible complications like infections. I could had complications from anesthesia. And usually, after you repair a knee, the knee is not like it was before the surgery, and pretty much everybody have downtime. For example, if you remove the meniscus in the knee, the meniscus is the cushioning and the shock absorption. As you get older, that cushioning goes thinner instead of getting thicker, and people start to have pain again. A complete knee replacement lasts for about 10 years, and then you need another knee replacement. And if the stem cell lasts just as much, it's kind of stupid to go through the pain and to go through physical therapy and to go through training when you could get an injection and end of story.
Wow. Next question. Are there any FDA approved stem cell therapies available for knee or ankle injuries? Could you shed some light on the regulatory landscape surrounding regenerative medicine?
Yes, FDA did approve six joints for stem cell injection. It did approve injections in the ankle, anywhere in the foot and ankle. That would be number one. In the knee and in the hip, shoulder, elbow, and wrist. So those are the six joints that are approved. However, stem cell are also approved for surgery with when we have cases of people with spina bifida stage 3, where the spinal cord of individuals is not encapsulated into the vertebrae. And those unfortunate babies that are born with this condition would never be able to walk ever. But the problem is not that they don't walk. The problem is that the pain is so atrocious. Um, if they do have a surgery at birth or even before birth in utero, and they encapsulate the neurovascular bundle into the stem in the umbilical cord, there is the potential that it's proven to be 0% a neurological deficit. That means you give the gift of walking to a baby for life and the gift of pain free. Uh, that is approved and paid by insurances for this type of surgery. Also, the stem cells are approved for people that have cancer of the eye. What happens, the doctor would remove the part of the eye that it's exposed to the exterior, and they would replace that part with a umbilical cord shaped as a contact lens, and they stitch the defect. They cover the eyes, and 5 days later, when they remove the stitches, the vision is back because the nerve is not affected. And it seemed to be an unbelievable treatment. That one, it's also approved. The name of the contact lens is called, contact lens is the umbilical cord, is called Procera, and is manufactured over here in Miami by the same company. Also, they got an approval for people that have ulcers, especially in the feet, like in the heel, where the bone is exposed. Usually, the necrotic bone is cleaned. This used to be a procedure where we would have to amputate 100%. Now we don't. Uh, what we do, we cut the uh, diseased part, the necrotic part, and we apply straight over the bone, the umbilical cord, and we do also do antibiotic treatment, and it seems to regenerate the heel to the point where people can avoid amputations. And this is also FDA approved. Recently, people that do prostate surgery, when they remove cancer of the prostate, they uh, envelop the neurovascular bundle into the umbilical cord. And it seems that those lucky people that get this addition of stem cell will not become impotent or incontinent. Some people are not looking for sex anymore later in life, but that it's also preserved together with incontinence, because you don't feel like walking and dripping urine when you go because of a prostate surgery. And this is a big deal. Yes.
Wow. So, good news. Next question. beyond stem cells, what are some other exciting advancements in regenerative medicine that show promise for treating joint problems?
Um, Besides stem cell, there are vitamins and there are hormones. Not too much is in generating, like for example, people that come with arthritis. Uh, Arthritis is a degenerative disease, and as the time goes on, arthritis will take its toll on people and slow them down. One of the best things people could do is to try to regenerate their thymus. Thymus is a gland in the neck around here, and in the opinion of many people, thymus is the fountain of youth. What it does, it is a hormone that pretty much acts in any part of the body. Also, another thing that people could do is to stay active. The word that many people are using in different contexts is you use it or lose it. It really applies here. If you do not use a muscle, the body has no reason to preserve it and to make it strong. Like, for example, if you don't use the knee and if you don't bend it, you're going to lose it. The more you exercise and the more active you keep, the more you have a chance to regenerate that knee naturally. That's why physical therapy works so well for many orthopedic conditions. Yes, physical therapy, good nutrition, yes.
Great. We often hear about the ethical consideration surrounding stem cell research. Could you provide some insights into the ethical framework and guidelines within the field of regenerative medicine?
Yes. I will tell you a little story. My mother was involved in a horrible accident 3 years, and she was airlifted to the trauma center here in Palm Beach. And of course, all the kids, we are 5 kids, went to the hospital. My father died in that accident. And I spoke to the owner of the stem cell factory, for lack of use, and he came to Palm Beach Hospital and talked to the doctors that did the surgeries for my mom. My mom broke her neck, broke both knees. It was a horrible accident. And I got a piece of stem cell, which is the biggest piece available, and I wanted to use it for my mother knee because she had knee replacement years ago, and the metal broke, the titanium broke in the accident, and I had never seen a titanium fracture like this, never mind the bone. And I wanted stem cell, and the head nurse of the operating room that was in St. Mary came and she told me, Dr. Farkas, I know you are involved in stem cell. However, this is a Catholic hospital and we will not allow you to have stem cell. I was so shocked. I said, how on earth do you think that I would kill a baby, excuse me, to take the stem cell and save a woman that is almost 80 years old? Are you okay? How could you think that way? Like that nurse, which only happened 3 years ago, are so many others. We do not kill any babies. When the baby is born, after the baby is given to the mother, the placenta with the umbilical cord are usually thrown in the garbage. Nobody save the placenta with the umbilical cord or make it grow into anything. Some people save it for private use in case they need it, but most of the people donate it or throw it out. Once the baby is born and that thing is discharged, that thing is enveloped and used as a organ that is donated, like an organ donor, and go through the same treatments as an organ that is donated. Nobody's killed and nobody. For the trials that they are doing the trials usually in the petri dish initially. Once that is done, they progress with the trials and they do the trials like any other trial with medication with mice. And once the mice pass, then they try it on people that wants to use it and they understand the process. Or they try it on animals like in sheeps, usually on sheeps, and the data is FDA. Once it's presented to FDA, the National Institute of Health give the manufacturer permission to use one case. The case is followed usually by an army of doctors, not one doctor, an army of, of doctors that supervise the procedure and everything is reported. That's what happened with spina bifida. After the first case is done, if it passes the trials, usually the NIH, the National Institute of Health, will give three other patients that consent. But it will be the NIH that designates which hospital and which city the operation would take place. For example, when it was the spina bifida case, the second trial where three kids got the approval. One was in Chicago, one was in Los Angeles, and one I don't remember where it was. But the manufacturers did not decide who will do the surgery or where or how. They just give the approval, they give the product, and the other doctors follow. There is no room for faking it or exaggerating because it is so controlled and it is so monitored to the teeth. Because this is not something that it's a Tylenol or a headache. No, no, no. This is completely different.
Yeah. As a leading expert, what ongoing research or advancements are you particularly excited about in the realm of regenerative medicine for joint problems?
Um, I know exactly that the articular cartilage could be regenerated. And this is new in medicine. We when I went to school, we were told that once you damage the articular cartilage, there is no turning back. That arthritis is inevitable, and do the best, and just manage the symptoms. Now we know that the articular cartilage could be regenerated. Uh, this is an unbelievable good news because that means a joint that was damaged when a person was 40 and now it's 60, full of arthritis, and their style of life is limited because of the pain. They could eliminate this 100%. We could prove that the joint is regenerated uh, because once the about 6 months into the therapy, we could take an MRI and measure the thickness of the articular cartilage, which it didn't happen before. Imagine, for example, if somebody has a meniscus damage. Instead of removing that meniscus, if you could regenerate it and if you could make it like new, you save yourself so much headache. But it's not headache, it's so much pain. So much pain, and it's so easy to take it. The drawbacks of this treatment is the money. Although the FDA did give the approval for the treatment, they did not give us a code. So that means there is no insurance that could pay for it because we do not have a code. It was really a slap in the face. But the biggest barrier for this treatment is the Orthopedic Association. And for good reasons. Because if I am an ortho and I go to school about 15 years after high school to, you know, first is undergrad, then it's medical school, so that's 8 years, and then is the residency, and then is the fellowship. It it adds up, and the money involved are so much money. You know, you finish school with 750,000 in debt, and then somebody comes, and instead of me making $25,000 for a knee replacement, I make $200 on an injection. Of course, I don't want that. Not only that, but um, once the knee is regenerated, the patient will seek my help in 30 years. If I give them a surgery, it's a patient for life. I give a job to the hospital, to the anesthesiologist, then everybody in the rehab loves me because the patient will go there for 3-4 weeks, and then it's the post-op, then are the x-ray, then the 6 months x-ray, and then the patient will have pain in 3 years, so he will come for another visit or two, and the whole thing lasts only 10 years, so then he's my patient for life. If I regenerate it, I don't see that patient anymore, and the money is no comparison. So I, I'm sorry to say, but money talks.
Yeah, for sure. And finally, what message or hope would you like to share with our viewers who may be seeking alternative treatment option for knee or ankle injuries?
Before you cut, do not limit your research on who does the best surgery. Keep your mind open and look for alternatives. There are always alternatives, always, and do not rush to cut. If I amputate a leg, like for example, somebody has a wound and I amputate, there is no turning back. As long as he has the limb, there is always a hope that that will be fixed somehow. Don't rush. Unless it's a dire emergency and you're gonna drop dead within a day or two if you don't amputate, don't amputate. Look for alternatives. Always seek somebody that is specialized on the field and have an idea. Feel confident that when you talk to a doctor, he understands your needs. Uh, and before you have the knee surgery, research. There is so much publicity on stem cell, so many research papers. The last time I checked, it was over 500,000 of research papers on stem cell. I mean, this is not something new. And people still, they go to the doctor. Sometimes they come to me. Is the insurance covered? No. Oh, good. I'm gonna go for surgery because it's covered. If your joint is not worth few $1,000s to regenerate, don't expect a doctor to put more value on your joint than you do. So always seek alternative treatments. Always, always.
Thank you, Dr. Farkas, for sharing your expertise and shedding light on the transformative potential of regenerative medicine. We greatly appreciate your time and insights today.
Thank you very much for having me.
Thank you very much and see you for the next videos.
Will do. It was a pleasure. Take care.
Thank you.
Bye bye.